Hello, AP Psychology students, and welcome to Chapter 11, Section 2. We're going to be discussing anxiety disorders today. So we're going to get into this one here. By the way, that's me in front of Canterbury Cathedral in Britain, throwing up some Wu-Tang. Wu-Tang's for the children. Anxiety, and we throw this term around a lot, especially in our modern society, is a general state of apprehension or psychological tension when we are nervous. And it is normal. It's a part of our life. It's normal to be nervous before a game or before a concert or before a test, to have butterflies in your stomach before you ask out a girl or a boy to a date. And there are studies that are showing that teenagers today have supposedly anxiety levels that mirror 1950s mental patients. So let's get into it because we throw this term around a lot, and let's really see if there's disorders or what's going on in society. So anxiety and panic. There is something called generalized anxiety disorder, which is continuous, uncontrollable anxiety and a feeling of foreboding or dread, like something bad is going to happen. And I don't know why. I just feel this impending doom, and I'm nervous, and I'm anxious, and my stomach hurts, and I can't eat, and I have headaches. That would be, if it's continuous and all the time, and you can't control it, you can't turn it off, that is generalized anxiety disorder. It occurs on a majority of days during a 6-month period. So we're not talking about, we go through periods where this is a really tough week coming up, or man, that was a really tough month. We're talking about most of the days over 6 months or longer to be diagnosed with generalized anxiety disorder. Some are caused from past history, some are from future expectations and things like that. One that we have is post-traumatic stress disorder, which used to be called post-traumatic stress syndrome. The symptoms are insomnia, agitation, jumpiness that continue for 1 month or longer after an event. Usually we associate this with soldiers returning from war, but it can happen to people that witness an accident. If you've been in a car accident, if you had a lot of trauma, anything that is terrible and shocking to you can cause PTSD. The causes are the aftermath of any crisis or any bit of trauma. Even abuse can cause PTSD. Those who are prone to development may have prior family history of psychological problems. They're really trying to understand this one. This one has a lot of research going on how to treat it, how to diagnose it, who's more prone to have it. And so there's still new information coming out on it all the time. 60% of Americans will go through some sort of traumatic event in their lifetimes, be it a sudden death of a loved one, a car accident, going off to war, you name it. And so it's how those Americans, how those people react to it. 8% of men and 20% of women develop PTSD. Those numbers are a little out of whack because they think that women are more likely to seek out treatment or a diagnosis or help than men who try to cope with the problem largely in our society on their own. And so most PTSD sufferers have a small hippocampus. Remember, our hippocampus is what relays the memories. That's just some correlations going on. And they're not really sure what's going on. They think that even in war, that constant explosions cause these little micro concussions, that those shock waves from explosions from guns and shells and things like that, when they're fired, cause these little micro concussions that can build up over time and cause PTSD. That's one of the later theories on that. And so the hippocampus is critical in the formation of autobiographical or episodic memories. Panic disorders, which is a reoccurring attack of intense fear or panic. Others have feelings of impending doom or death, very similar to anxiety disorders and things like that. The symptoms can be trembling and shaking and dizziness, chest pain, rapid heart rate, feelings of unreality, hot and cold flashes, sweating, fear of dying, going crazy, or just losing control. In fact, they mimic the symptoms of a heart attack. So many people that are having a panic attack believe that they're having a heart attack. Excuse me. The causes, usually they occur in the aftermath of a stressful situation, prolonged, hurtful, negative emotions, specific worries, or even very frightening experiences. Normal people, and I don't like using the term normal, I should have typed it something different, recognize the attack as a passing event and they can go on with it. I think these are becoming more and more prevalent though. Others see the attack as a sign of illness and adapt their lifestyle to avoid another one. So then that goes a little bit into fears and phobias. We all have fears. We all have things that spook us out and make us jumpy. But a phobia is an exaggerated fear of a specific situation, a specific activity, or a specific thing. Some have developed because there are real dangers to humans. Most people are afraid of heights. Most people are afraid of snakes because they are dangerous to us. Most people don't like enclosed dark places. That's pretty normal to have those fears. And so those are things that humans kind of across the board kind of, we fear. It might be evolutionary. People that played with snakes probably got bit and didn't have kids. Others are acquired through classical conditioning or observational learning. Sometimes operant conditioning is going on. There's the fear of cats, the fear of the color purple, which is porphyrophobia. Some reflect personality differences or cultural traditions. Like here, we have an elevator that's obviously missing the 13th floor, which if you jumped off the 14th floor with a parachute and you thought, hey, I got time to open this chute, you're one floor closer to the ground. You might want to open that parachute a little sooner because you're actually on the 13th floor. But that's a cultural thing where we don't like the number 13, which is trichodecaphobia, by the way. So the fear of germs, the fear of the number 13. Here, let's watch some Maury Povich. This lady doesn't like pickles.
Afraid of pickles. I mean, the whole world eats pickles, but it's ruining her life. She's teased in school, and she, of course, in school was called the pickle girl. Once you know, this is what the sight of a pickle does to Mariah.
Everything about pickles are destroying my life. People make fun of me and so ashamed and I'm afraid of them. When I think about pickles, I just want to throw up and run away. What I hate most about a pickle is the shape, the texture of it, the color.
We wanted to see firsthand the extent of Mariah's pickle phobia. So we sent her to the Patterson Pickle Factory.
Come on,
where she
Maury.
would come face to face with thousands upon thousands of pickles.
I'm making a video. So if you look at that, she probably had a traumatic experience with a pickle, or she got sick from a pickle. Classical conditioning. Here's Jimmy Kimmel making fun of Maury on another one.
This is great stuff. On the rare occasion that Maury Povich can't find a woman who doesn't know who the father of her child is, he falls back on an equally classic move, scaring the hell out of crazy people. Now, Maury, today he assembled another panel of guests with unusual phobias, including this woman named Margaret, who's scared of Jell-O.
Jell-O, it really makes me sick. I don't want to see it, and I definitely don't want nobody putting it on me. I don't want people to think I'm crazy because I'm not. But Jell-O scares the hell out of me. There are times when I think Jell-O is out to get me. I stopped going to family reunions because of Jell-O. I quit going to restaurants. I have a hard time dealing with this. Jell-O's been controlling my life too long.
It has? I would love to know in what way. But Maury doesn't ask that. What he does is once the phobia has been established, he brings whatever you're scared of out and terrifies you with it.
Stay right here with me. Don't run off. Okay? I'll tell you when to look around. We're going to bring out some Jell-O.
So those people actually signed a thing to go on the show and hopefully get some help for that. Here's the top 10 weird phobias. This one's kind of interesting. Fear of cheese. Ew. love the all names, Greek names, except for fear of the Dutch. This one's funny too. That's the fear of long words. If you diagnose them, they would freak out. So there's a lot more online. You can find many phobia videos. They are a little humorous, but they're a serious thing. Phobias are truly frightening to people that have those. They're often incapacitating, and then they just avoid it. Like the woman with the fear of jello said she stopped going to restaurants. So that's changing their behavior to avoid what scares them, and they have panic attacks often that are associated with that. Social phobia sufferers are anxious when they're in situations where others will observe them. They think people are watching them, so they stay home. Agoraphobia is the fear of public places, which some people call the fear of fears because they just don't go out. They don't leave their houses because they fear being, basically the panic attack. And so people want to avoid the panic attack, and so they just stay at home. And so you have the fear of fears, which, by the way, the guy in Benchwarmers did not have agoraphobia. He had heliophobia. He had fear of the sun. So let's move on. Obsessive compulsive disorder. We throw this one around way too much in our society. The idea of OCD. If somebody likes to do things in a particular way, or they like things neat and tidy, that does not make them OCD. Obsessive compulsive disorder is recurrent, persistent, unwished for thoughts or images, or by repetitive, ritualized, stereotype behaviors that a person feels have to be carried out to avoid disaster. So if you have things that just pop in your head, they won't go away, and you can't stop them from going away. That's an obsession. And then if you have a compulsion to do a certain behavior over and over again because of a fear of germs or a fear of odd numbers or something, and you feel like there's impending doom if you don't do so, that is OCD. And so these go for trivial. They go further than trivial compulsions or superstitions. Like tying your right shoe for your left. That's not OCD. Alphabetizing your music collection is not OCD. You just like things neat. So both obsessions and compulsions seem uncontrollable. Many sufferers have depleted serotonin in the prefrontal cortex, and so we know that there's a chemical imbalance going on there, which leads to more rigid thoughts. Some have other parts of the brain just simply being hyperactive. They're firing too often. Hoarders are now being classified as an OCD classification as well. Here's an old 90s video on OCD. It's really well done. You can tell it's dated by the hairstyles and the appliances.
The touch of a doorknob, light switch, or phone triggers
That's a
overwhelming
phone.
anxiety in Gail Taylor.
It's as if someone has a gun pointed right here and says, you have to wash because you're contaminated.
For the last 12 years, Gail has spent a lot of time washing her hands. She suffers from a fear of contamination, one of the most common symptoms of obsessive-compulsive disorder, or OCD.
OCD is characterized by recurrent and disturbing thoughts, ideas, or images
Sweet stash.
referred to as obsessions, and/or behaviors that the person feels driven to perform, which are referred to as compulsions or rituals.
There's a pre-wash and then a regular wash, and then each fingernail, the faucet has to be washed and rinsed. How many times a day do you do this? Anywhere from 8 to 200.
It all began 12 years ago with the birth of her daughter, Heather. Gail became obsessed with germs that might hurt the baby. That later evolved into other fears. Eventually, Gail's marriage broke up. She had to give up her career in teaching. Even her own daughter began to represent contamination.
I didn't want to touch her homework or her books or give her a hug.
To get a hug, Heather had to go through a cleaning ritual.
Yeah, I had to be virtually clean. I couldn't touch. I would take a shower and then I couldn't touch any of my stuff.
This man also spends a lot of time washing. He's Gail's fiancé.
He puts up with a lot. He doesn't get to sleep in the bed unless he takes a shower. He has to sleep on the couch or the floor.
Why do you do it?
Well, I guess it's because it's love for the person, and hopes that things will be better.
All around the house, there is evidence of Gail's fears. The dining room is a holding area for both clean and dirty items. Then there's the downstairs.
Everything that gets contaminated that I can't wash or that I don't get to wash, ends up down here.
And you have some pretty creative tricks for getting around down here.
Yeah. Throw a doorknob every day.
Every time you do that with it?
Every day.
Why can't you touch
The doorknob. What's contaminated? In my head, it's contaminated.
You may think Gail is crazy. She's not. She knows her behavior is irrational.
It's essential to the diagnosis. So if they've lost the capacity to have insight into the excessiveness of their behavior, they no longer have OCD. They would be considered psychotic.
Dr. Goodman says some people may be biologically predisposed towards developing OCD. One theory is that a brain chemical called serotonin is out of balance.
Certain kinds of antidepressant drugs are currently being tested to treat OCD. They appear to somehow alter the chemical imbalance in the brain associated with the disorder. Some patients also improve with behavioral therapy, a technique in which they're exposed to the things they fear and forbidden to indulge in their compulsions.
Why don't we touch some of these things just like we do in the office?
This is the first time Gail Taylor has tried behavioral therapy at home. Therapist Joe Ricciardi is asking her to touch items and rate her anxiety level. 100 is the worst.
What would you rate your discomfort?
It's about at least a 50.
At least a 50?
Yeah.
This is from Heather. Now, where do you rate that as you hold on to it? Really hold on to it. Put your hands right over it. Good, good. Where do you rate discomfort as you hold on to that?
About 80.
The more you can hold on to it, you're doing really well. The more you can hold on to it, the quicker the discomfort will fade.
The session moves to the kitchen, where Gail is asked to touch her clean counter after handling items she considers contaminated.
It's crucial that you use it just like a regular countertop, in spite of the discomfort that you feel. All right? Can you do it?
Maybe.
Maybe? Can you say?
I'll give it a try.
All right.
With therapy and medication, Gail is slowly breaking free from her prison of fear. One of her greatest improvements is with Heather.
We do engage in a lot of physical contact, I guess, now. But I was never allowed to do that when I was little. Now I do have a lot of hope. My life right now is pretty productive and it's almost normal. Almost.
Diagnoses of OCD with germs and things like that, fear of germs and contamination, maybe going to go up because of the coronavirus. Here's a fun one. It's always good to have some Star Wars involved. All right, that's all I got for that one. If you have any questions, let me know. Next time we'll move on to mood disorders.